Tory leader Kemi Badenoch says absolutely not, but that doesn't mean you have to agree with her. Mammograms, of course, are breast x-rays and they look for cancers that are too small to see or feel. Currently, only female staff can perform them. They're offered to women between the age of 50 and 71 every 3 years, but there are currently critical staff shortages among radiographers. Those are the people who specialise in doing them. So the Society of Radiographers has called on the NHS to allow men to perform mammograms too, to ease the backlog. So Dr. Philippa, you spend quite a lot of time, as you just told us in the break, examining prostates and looking at men's willies. And it's not just for pleasure, it's for work.
It's absolutely for work. Let's put it out there. So there are male midwives, there are male nurses looking after female patients and vice versa everywhere. And it seems to be that this is a specific area where the healthcare professional has to be female. Now, we are at a 17.5 to 20% vacancy rate for mammographers.
Right.
There are lots of barriers to having your breast screening. And one of them is we don't have enough people to do the screening. And so for many people, this is an easy yes. And we have to remember that mammograms save about 1,300, so 1,300 lives every single year. Does that mean that it's perfect for everybody? No, and it might be that if you are a survivor of a sexual assault, if you are from particular cultural or religious groups, that is more difficult. And in an ideal world, we'd be able to tick a box that says, yes, I don't mind having a male, or yes, I do. And that would be ideal. But we need to get the numbers of women attending screening up. The latest data suggests that only about 2/3 of women are attending their screening, and yet breast cancer affects 1 in 7 women in the UK.
Wow.
So it's a lifesaver, that's the whole point.
Absolutely.
That's the whole point.
It picks up something before you would pick it up yourself.
Yes.
And when it comes to cancer, early detection means that you are much more likely to be able to have successful treatment and just live away.
But what I want you to do, Dr. Philippa, and I've definitely heard you talk to me about this before, is when you are the doctor and you're female, and there's a man with all his bits, his whole lunchbox is all hanging out and everything else, and you have to look at it, or you have to look at his back passage, or you have to, you know, the intimate places that you wouldn't normally look at if you're having people over for dinner or you're talking to them in the street. What is it like from the doctor's point of view? Because I know you've told me before, people are so embarrassed. And in fact, so embarrassed, they sometimes don't even want to get their problems investigated because they feel shy and they feel these are private places and they don't want to show them. So tell me what it's like from the doctor's perspective.
I don't think of it any differently if I have to examine your backside, your penis, your vagina, or if I have to examine your big toe. It is literally a part of your body, and I am only focused on doing the best job I can. So I don't care if you have had a waxed, if you are wearing your best knickers or not. It doesn't even occur to me. Now, I totally understand that as a patient, that might feel different. And yet we have to keep on having these conversations. We have to use the correct terminology because, you know, breast or nostril, we are talking about parts of the human body that everybody has. And the other thing to say here is that, you know, your healthcare professionals are simply trying to do a good job. And yes, there are, unfortunately, will be people everywhere in all walks of life that do better jobs than others. But the idea that everybody has nefarious reasons for wanting to do the job they're doing actually is quite maligning of healthcare professionals that are just trying to help.
Do you feel a bit differently about it? And I've had a chance to hear Dr. Philippa and think about this one, Kirsty.
Well, no, I as I say, initially, the idea of a male doing my mammogram, I was just saying, you know, it is slightly uncomfortable because I found it uncomfortable the first time. And then I've had a couple now and I'm absolutely fine. They don't hurt. They're absolutely the best thing you can do, as you said. And it is what it is. And do I think there should be male mammogram nurses, technicians, radiographers? Yes, I do. Because I've had a male gynaecologist. Why would I not have someone?
Well, exactly.
You know, I'm very open to this.
Let's go on the phones, because Joe's on the line in Hampshire. Hi, Joe. Thanks for getting in touch. What do you think about this? Kemi Badenoch says absolutely not. What do you think?
Oh, no, absolutely, yes.
Oh, OK.
Because I worked for breast screening for quite a long time. And it was very interesting. And, you know, the fact that mammograms, they say, are painful, they're uncomfortable. But I think you've got to think about the end result. Because they do save lives, I think.
Absolutely. But what about the idea of, you know, a man opens the door and says, do come in. Yes, I shall be doing this. And I take off your bra, take off your shirt, you know, just go and stand over there. And then what normally happens is the mammographer kind of eases your bosom onto the sort of plastic plate, which is going to be squeezed between the two plastic plates, don't they? They kind of help you ease your bosom on. And Jo, do you think most of the people who were availing themselves of the services that when you were working, most of the women would have been comfortable with that? Do you think they'd have been all right?
I think it would have been because, you know, as I say, I think the whole point is the fact that, you know, it's a matter of saving lives. I've just had a friend who went for a mammogram and she had breast cancer. Now, if she hadn't gone to have a mammogram, it could have progressed and everything else.
Absolutely.
I think
You know,
it's also important to say that when we are putting people in a position where they might have to show a part of their body that they are uncomfortable with, but actually, even if you're just examining a tummy, that you'll be offered a chaperone.
Yes.
So you're not going to be put in a position where you are going to be left with a male healthcare professional without a female chaperone in there. And there's often ways around things. So somebody might say, would you mind if I lift my breast onto the plate? So there's often a discussion to be had. I think that we have to be sensitive that for some people that absolutely might be a red line. But for many people, it won't be. And in particular, I wanted to say that Kemi Badenoch said that it's a very, very intrusive test. And I think that that's not the message that needs to get out there.
I had it on TV only a few weeks ago in order to show that it's not.
So for many women, it is quick that they might say, I feel a little bit of pressure. They might have a little bit of tenderness at that moment in time, but that it is not a particularly intrusive test in comparison to some of the other investigations that we might have, and that we actively need to be encouraging women to go, not putting them off.
Let's talk to Anne in the West Midlands. How do you feel about it, Anne?
Well, how do I feel about it? Well, I'm all for it because I've had breast cancer.
Right.
I've had many men look at my breasts. I've never felt embarrassed. The way the national health is, I can't understand why people are complaining.
Right. And just tell us about, you know, finding the breast cancer. Was the mammogram part of finding that you had it?
Yes. Unfortunately, I was a patient of the man who is now in prison.
Oh, dear God, that's a whole different story. I think we'll move on, Wendy, but I just hope you're making a speedy recovery, and thank you very much indeed. Nice to talk to you. So, I mean, Wendy said, you know, so many men had looked at a breast in a medical capacity because obviously if you do find that you have cancer, you'll go on to have other treatment, whether it's radiotherapy or chemotherapy, and it might well be that there's a male there.
Of course, you can't pick and choose. I mean, you're surely going to do. Wouldn't you agree that whatever's best, you're going to get there and
So
do
it's not
it.
just that you can't pick and choose. Even if you could, you would want the best
That's
professional
right.
to
Absolutely.
do who's best at their job.
Yeah.
And the idea that you could define whether or not somebody was good at their job based on their gender alone doesn't sit right.
Right. Let's talk to Wendy in Aberdeenshire. Hello, Wendy. How are you?
Hello, I'm fine, thank you.
Good. What do you think about it?
I would be quite happy with a man helping to do the mammogram.
Right.
I feel that they could be more discreet and more thoughtful towards it. I unfortunately have felt pain in my last mammogram. There are clips that have been left within the breast, and they quite clearly, I feel, went down and clamped me down too tight.
Oh, okay. So,
And I was never given a gown. I saw your exam on the television recently, and you know, I haven't had a gown more than once and twice that I've been.
Really? So have you had to stand there kind of, you know, your top half naked holding your boobs like that?
I was asked to put back on my cardigan and come into the scan the first time, and the last time I went very recently, I was just asked to undress in front of the machine.
Right, okay.
Which was really very, very odd. But I did ask, did they have a shortage of gowns, or were all cubicles full?
Right. I mean, I don't think the NHS really provides gowns in general, does it?
Not necessarily, but that doesn't mean that you can't go prepared with a shirt and say, can I just have my shirt on just until we get to right at their machine?
Yeah.
In the same way that I would say to women who are uncomfortable having cervical screening, wear a skirt, a long skirt, then you can easily just pull it up and down.
Yeah.
So there's often ways around, and if people are anxious, I really would encourage that they would go and speak to their doctor or nurse about it. And remember other little tips. So if anybody is about to go and have their screening mammogram, things like no talcum powder that day, no spray deodorant that day, because that can interfere with the machine. machine and us being able to read the machine, that you can use roll-on deodorant. So there are lots of little tips and tricks that we can do to always make it more comfortable. And I guess the real message is if you aren't comfortable, tell us.
Yes. Let's talk to Jean, because we've had lots of people saying, I wouldn't mind if it was a man, I wouldn't mind. But Jean doesn't like the idea, do you, Jean, of a man carrying out a mammogram? What is it you feel about that?
Well, apart from the embarrassment
Right.
of it all, I'm 83 and I've never had children, so I've not had much investigation of my bits. If you get me,
I do.
I had one mammogram once,
Yeah.
and it was so painful. I can't tell you.
What a shame.
And I put up with it because I thought, you know, a lady. Well, it's always been women, but they press your breast as flat as a pancake, and if they're already sore, it doesn't help.
No.
I bet you any money that machine was invented by a man rather than a woman. It wouldn't surprise me. And imagine men having their willy squashed flat on a machine. I don't think they'd be putting up with that.
I think we have to be very grateful that the machine was invented at all, because think of how many lives it saves every year, as Dr. Philippa just told us. How many?
1,300 every year in the UK.
1,300 lives in the UK being saved by that wonderful machine. So quite frankly, I bless the name of whoever it was that invented it, Jean. Lots of love to you, and thank you so much for calling. Many thanks to Dr. Philippa. Lovely to see you.